Welcome back, everybody, to another episode of the Internal Compass podcast. I'm your host, Samuel Archambault, and I'll do my best today in this episode to help you and guide you to realign from inside out. So, in this episode of the podcast, let's talk about the link between pain, especially chronic pain, and mental health. And I want to tell you and explain to you and give a little bit of context to you on why did I decide to go with this topic for this week? Well, I have been listening to this one very interesting documentary back from Canada about Lyme disease, and especially the part that really interested me the most, because of course it was about the disease and like the information that was spread, and especially about the misinformation and how that misinformation could lead to errors in how people would interpret different information about the disease, and how that misinterpretation would cause new symptoms. In other words, this is not a new topic. This is not a new concept on how the brain can create different symptoms, especially that for pain, especially actually pain is a concept created by the brain, and it is not something created by the body itself. It is actually an interpretation, especially in the case of chronic pain. So without further ado, let's deep dive a little bit about that connection between mental health and chronic pain. So today we will cover 5 things and 5 different association that mental health and chronic pain has. And of course, I will do my best to give you solutions and alternatives and ways that you can start to approach those different elements. So, first thing that chronic pain is going to have an effect on when it comes to mental health, and that is the creation of limiting beliefs. Just to be clear, those 5 elements, starting with limiting beliefs, they're not necessarily going to come along as an automatic fact. If you, for example, suffer from chronic pain, it doesn't mean that automatically you have created those limiting beliefs. It just means that this is a more potential risk, that because of chronic pain, people who suffers from it have a higher risk of creating those limiting beliefs. And what I mean by creating limiting beliefs, it is because there is a whole bunch of beliefs around pain that will be created whether we like it or not. That is not something that we can consciously decide to do. Okay, yes or no, I'm going to create beliefs. But we can decide to create beliefs that supports us. And we can also decide to create beliefs that doesn't really support it and actually will limit us in our healing journey. Let's take a quick example. If you have been in chronic pain for some time, imagine that you hurt your back once and then it just never kind of go away. Like it never went away. It just keep piking up, down. It's a bit less, a bit more, but it's just there all the time. It's been 6 months now. So in that situation, you could be thinking many different things. Someone could be thinking about, well, you know what? Maybe that pain is because of that specific movement I did back then. Therefore, that specific movement, which for instance was I bent my spine, well, bending my spine is bad because it created my low back pain that is now chronic. That I would consider a limiting belief, because a limiting belief kind of limit the concept to being a clear cause and effect. In that case, I bent my spine and I have pain. But if I bend my spine right now and I don't have pain, do you see there that there could be a mismatch? And this could be very challenging for some people, and maybe for you if you've been, having those different beliefs. Right now, I could pinpoint that's one specific, but there are some others that people will really believe from deep down that their pain is especially because of this one thing, and it could be because of some type of illness, it could be because some type of a movement, it could be because in their family they always have a bad back or bad ankles or whatever it might be. But again, now my role is not to judge whether those beliefs are good or bad. It's just that they might be limiting you in a way that from now on, that means that you will try to not, in that same scenario, bend your spine forward. which in rehabilitation setting we will want eventually to do, because we want to deconstruct those different mentalities and beliefs. So this is a strong link that can occur, and that depends on a whole bunch of different factors. What has been your education on pain? What's your culture like? In what context the pain occurred? There are many, many different things that will influence what kind of a beliefs you're going to create about pain. But one thing for sure is that if you're able to challenge your own thought using approaches like CBT, cognitive behavioral therapy, by just asking, is there any proof of that? Maybe that's one event. You bent your spine once, and then that actually created the pain. But did that happen all the time? Every single time you bent your spine, did that recreated the pain? Maybe yes, probably not. So try to challenge yourself that way. If you're more curious about CBT, I encourage you to go and seek out your own research about the approach. Another thing you can do, of course, and that's one thing I will say a lot in today, is to seek professional help, because a professional will not only be able to educate you on pain, but also will help you and support you and guide you, hopefully without judging you, around your beliefs along your healing journey. All right. So the second point is mental stress. Of course, if someone suffers from chronic pain, it's almost inevitable that at some point this is going to create some stress. Well, why? Because of all the things nowadays that people can't do because of stress, of pain, excuse me. Imagine that you have always been someone who have been very active and someone that can do many different things, and out of a sudden you can't. Another example would be you can't even work because of your chronic pain. Imagine that kind of a stress, financial stress, mental stress. All of those things are going to create and take a toll on you. So all is not lost. I'm telling you, this is completely normal. If you've been in pain, it might create some stress. And when you have those surges of stress that you feel really like, oh, my heart is beating fast, and then you start to have all of those thoughts, those kind of catastrophizing thoughts, well, use your breath. Really long exhale through the mouth and smaller or shorter inhale through the nose. There are very good ways that you can really relax your nervous system. So by using your breath, long exhale or short inhale followed by long exhale, this is going to help you. It's not going to solve everything. It's not going to completely make your stress go away, because it's going to come and go. But if you're especially in an acute phase of stress that right now it's taking you and you need to do something, using your breath is a great tool. Let's keep going. So the third thing, how chronic pain is going to link with mental health, is isolation, especially social isolation. Why, you might ask? Well, if you have ever been suffering of pain, do you really want to start, you have back pain, you have neck pain, maybe you will want to stay away and not go for all of those trillions of activities, right? Maybe you want to stay home, and slowly but surely things get more complicated. I'm just thinking about elders, people that start to lose faith or lose confidence in their body, and therefore they prefer to stay home, while actually what they would need is exactly the opposite, is to force themselves to, considering their limits, do what they can, go connect with people, go outside, go seek help. By isolating yourself, you, of course, augment the risk of not only causing other types of mental either disorders or just mental issues, because of course we all know how social connection is important. But not only that, but you will also reduce your level of activity in general. So both of those things are really important. So the not so intuitive, or kind of the solution to this, is to go and seek relationship, and especially people you trust. That's the important part. Now, I'm not saying you have to do all of the activities and you have to say yes to everything, but can you pinpoint some relationships, some activities that are important for you, and kind of creating a plan, put them in your schedule, make sure that it's there, make sure you have a plan on how to do it, by thinking through it, and see that, hey, finally, you know what, even with my pain, I can still do it. If I if I can make it something a bit more logical, if I can organize it, if I could have some help, if you plan it in advance and deconstruct that maybe big mounted of how you perceive this activity, well, maybe this is going to help you and definitely will make it more accessible. So reach out to people that you have confidence into, and also make a plan for those social activities. So fourth way on how chronic pain will impact mental health, and that is the shift in identity. That's a big thing, especially for people that are very active, because it's kind of something that is taken for granted, right? That we can just move around, we could just move our body. And especially if you are someone that is very active and really enjoys, there is for all of us, there is going to be a moment in our life that we can't do all of those things, whether it's because we start to get a bit older and maybe just by the fact of age, we want to protect our body more. Whether it is because something happens to us, so a big injury, or we get into more chronic pain. Maybe it's because of natural things, right? I'm just thinking about pregnant ladies. Can you do the exact same thing as you were doing before? No, you have to adapt, but you can still move. You can still keep moving. And the important part here, coming back to the identity shift, it's not that you have to completely change your identity. Maybe this is a great opportunity, and that's my tool for you to ask yourself some questions. Okay, maybe now life is different. I can't base my whole identity on what I used to do before. Well, who else am I? What else am I? Are there other activities and other roles that defines me? Can I reconnect with other parts of myself that maybe I have left in the past? So example, I have gotten recently an operation for my ankle. Did my identity shift? No, not really, because I haven't been stopped for that long. But the fact that I have kind of been forced to settle down made me realize that, hey, I wanted to write a little bit more. There were parts of me that, those introspective parts of me, that if I'm like, go, 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 I do many, many things, it's not so present. So by allowing yourself to not get attached to those specific parts of your identity, you can question yourself, hey, what's the opportunity right now? And who else am I? And what else am I? So I invite you to revisit your values, revisit your what's important for you. So all of those things, it's just an opportunity. Okay, so the fifth one is it's going to be interesting here, and that is the especially the biggest risk when it comes to mental health with regards to chronic pain, and that is in a way more pain. And what I mean by that is more mental pain, because chronic pain, if you've been following my podcast until now, you have watched some episode that that physical pain and mental and emotional pain are all intertwined. They're all the same thing in a way. They are a creation, right? A pain is an interpretation of stimuli in our brain, and now I'm talking about I'm talking about chronic pain. It's an interpretation of many stimuli. All of those stimuli are emotional, physical, mental, neurological, hormonal. There are a whole bunch of different things, and with that information, our brain makes a guess that something's wrong. I should be in pain to protect myself. So those things are together. So if you have more long chronic pain, physical pain, eventually that's going to create mental pain, and eventually that mental pain will, so someone in chronic pain, actually like in the literature, that's what it says, the risk of not contracting, but let's say to suffer eventually from a mental disease or a mental disorder or mental illness, call it however you want, is actually higher. So in other words, in simpler words, if you've been in chronic pain for some time, your risk of having anxiety, depression, and other mental disorders such alike is going to increase. So does it mean you're going to be in a depression as soon as you have chronic pain? No, the risk goes higher. It depends of your previous experiences. It depends on your level of resilience. It depends on a whole bunch of different things. But what you can do for this is knowing that your risk is higher, right? It's the same thing as if you eat a lot of junk food, well, your risk of being obese is higher and your risk of having cancer is higher. Does it mean you will have cancer? No. But what you can do in the context, going back there to depression and mental health disorders, is to stay aware of symptoms. Look at yourself, right? If you've been in chronic pain and out of a sudden you wake up in the morning, you feel completely demotivated. It's been like a month that every single time you wake up, you have no energy. You start to be very demotivated. You're irritable. Your sleep is really not good. Those things starts to pile up, and you might want to think, hey, you know what? Maybe right now I'm leading myself into the direction of anxiety, of depression, or other mental illness. So again, it is not to be alarmist. It's to be realistic, and also it's to show you that you want to care about yourself. So basic awareness. And of course, I come back to this, but seeking professional help. We are the worst. Even me, I'm educated in this field, and I'm the worst for myself at looking at those things, because it's like when you review a text that you've been working on, after like 25 times you've been looking through it, you don't see the few mistakes that's left there. But someone with an objective view, a professional that all they do is they are helping you to get better, those people can help you really progress and look at those symptoms and then seek, okay, what's the best avenue? Are we looking at some behavioral changes? Are we looking at some medication, depending if it's a physician or if it's a psychologist? Or pick your best sauce, if you may. But seeking help, start somewhere. This is definitely going to help. So I hope this helped. Just to do a quick recap here, different ways on how chronic pain can impact mental health. We said that it might, all of those are higher risk, not necessarily cause to effect, but lead to creating false or limiting beliefs. Then we talked about mental stress. We also talked about isolation, social isolation. It might create a change in your identity. And then finally, higher the risk of suffering from a mental illness such as depression or anxiety. So for that, you have different tools. Seeking professional help. We talked about different approaches like challenging your thoughts, using CPT, or just try to think, okay, is there any proof to this? Then we have seeking support from people that we trust and planning some specific social activities that we would really like. Going forward is, if we have that change of identity, perhaps using that as an opportunity to grow and connect with other parts of ourselves. And finally, stay aware of the symptoms of different mental health disorders and seek help if necessary. I hope that helped, and I hope that your understanding on how chronic pain and mental health are intertwined, and hopefully this helps you going further. So I wish you health, and I wish you that you are furthest along the way on your healing journey. On that note, very happy that you spent those now almost 18, 19 minutes with me. And I'll see you in 2 weeks for another episode of the Internal Compass podcast.